so you still socially distance, you still wear a mask until we get more information and we know that herd immunity or just relative getting it out of the population takes place. So even if you get vaccinated, you absolutely still need to be wearing a mask. You still need to be social distancing because it's going to take a little bit of time. I just wanted to make sure that I noted that. So the next question that I want to answer, let's see. Oh gosh, I lost it. I'll skip to another one while I look for that one. So I think you kind of already spoke to a little bit about clinical trials and the fact that they get a diverse population of people, but specifically Black, African American, depending on how you identify yourself, were they tested in the clinical trials? Was it at a similar percentage as other populations?
Yeah, so the answer is yes, they were. And there was a really strong effort to recruit Black people in the trials, an effort to recruit other minority groups, as we refer to them in the US, in the trials. And so the answer to that question is yes.
Okay, perfect. And then so I found the question very quickly that I just wanted to address, and I know we've been throwing out the terms already, so apologies, but so SARS-CoV-2 is the virus, and COVID-19 is the then subsequent illness that results as a result of you getting SARS-CoV-2. Is that correct?
That's correct.
Yes, and SARS-CoV-2 has SARS in the name because of the shape of the virus and the portion of your body that it affects, not because it is a another version of the SARS that happened earlier in the early 2000s, maybe. I don't remember exactly what year that was, but.
Yeah, that's correct. That's correct. So yeah, so coronaviruses have a specific characteristic shape to them, but there are different types of coronaviruses. SARS-CoV-2 is the one that we're all kind of dealing with now, but there are other milder coronaviruses that have been around for some time. But SARS-CoV-2 is obviously the more severe one and the one that we're dealing with.
Okay. Yeah, thank you. Okay, so I'm gonna go now down into the Q&A section. So like I said before, if you have a question that you would like answer, it's easier to manage if you put it into the Q&A section as opposed to the chat, but I'm going to try to make sure that I get to all of them. So please just bear with me, guys. Okay, so the first question says, is it okay to take the vaccine if you have uncontrolled lupus-like illness or you are in a flare? If the inflammatory response is very high, ESR, CPR, etc., or do you need to get that flare under control before you take the vaccine?
That's a great question. You would need to get the flare under control. There are a couple of reasons why, and we generally don't give vaccines to people who are having any sort of active illness for a couple of reasons. But the main one is that one wants to know, if you were to have a reaction to the vaccine, one would want to know that this is the vaccine that's doing this as opposed to the lupus. And so you would want to try to get that under control and then get the vaccine. Then if you happen to have some shoulder swelling or pain, we'll know, okay, that's the vaccine, that's not lupus. Or if you were to have some body aches, we'll know, okay, well, that's the vaccine, and so forth. So it'll be important to get that under control first.
Okay. And then let's say a person has had reactions to previous vaccines. Are there any reactions that would make you advise a person not to get the COVID vaccine. I know that a particular polymer called PEG has been a more recent topic of discussion because it's present in some vaccines and not in others. And there are some people that have an allergy to that material.
Yeah, so that's that's a great question. So in the clinical trials, there were no instances of an anaphylactic reaction, which would be like an immediate allergic response to the vaccine. That being said, that doesn't mean that can happen. It doesn't mean that that'll never happen. It just means that it's something that we don't anticipate would be common. In terms of vaccines, you know, so there are different types of reactions. I refer to anaphylactic. Anaphylactic will be if your throat's closing and you know, so that's kind of the more serious one. There are reactions where people break out in a rash and a hives. That's not life-threatening. You know, there's some local reactions where one has kind of pain in the shoulder and so forth. A lot of the vaccines have been formulated a little bit differently now so that they don't have too many of those components that, and I'm talking about historic vaccines, don't have too many of those components that could trigger those types of reactions. But certainly it would be important to discuss with your provider what sort of allergies you have. And then the provider in turn will be able to kind of look specifically at the vaccine and see. Now, for the mRNA vaccines, a lot of them are built in sort of a lipid nanoparticle. And so people who've had some reactions have had some reactions to that lipid nanoparticle. It will be hard to know who's going to react to that or not up front. But if you know that you've had an issue with that, certainly, you know, let your provider know.
Okay, and I cannot believe that I skipped over this, but the new variant that has become increasingly more popular, I believe that a couple of days ago, the US actually identified its first case of the new variant. As far as the vaccines go, because they were developed before this new variant, we became aware of it. Does that mean that it's still advisable to get vaccinated? How effective will the vaccines that we currently have be on this new variant? And sorry, one more question. How do we know if they aren't going to be effective? How would we be able to make that determination since it is newer?
Yeah, so excellent questions. The new variant came out based on what we know about the structure of that target protein on the new variant. We think the vaccine should still work. The way we'll know for sure that it'll work is by monitoring people who get the vaccine, not just those who are still being followed and monitored in the clinical trials, but also post vaccine surveillance of all of us who are getting it, to see if we're still getting COVID, and if we do, is it old variant or new variant? And so that's how we're going to know for sure. But based on what we know about this virus, it has had small mutations, you know, from the jump. You know, unfortunately, that's what viruses do. And we still anticipate that the vaccine would still work.
Okay. You spoke about, so another question from the audience, you spoke about the fact that if you know that you have an allergy to something, you should ultimately speak with your provider prior to getting it, because they can advise you on what's the best decision for you, although there's no evidence that indicates any severe anaphylactic or allergic reaction would take place. What about a person that has an autoimmune condition? And so already is potentially immune compromised, like lupus or something else?
Yeah, so the recommendation will be to still get the vaccine when your time sort of comes. There's no indication from the trials that having an autoimmune condition will be a contraindication to getting the vaccines.
Okay. All right, so this is another question. It says, I've heard in trials 4 participants developed Bell's palsy from the vaccine, and none of them were in the placebo group. I suffer with Bell's palsy myself, and for this reason, I don't want the vaccine for this reason. Am I justified in standing my ground? Many thanks.
That's a very very good question and a very good concern. I think um, when you consider that thousands of people got the vaccine, um, and maybe 1 or 2 people may have had a particular adverse event, and trying to decide whether that adverse event is actually tied to the vaccine or not. I would say that the likelihood of getting Bell's palsy from the vaccine will be extremely low. That would be my summation of that. Again, remember, well over 40,000 people were included in the trials. And then subsequent to that, although the vaccine rollout in the US has been relatively slow, we've had millions of people so far, a small number of millions of people get the vaccine. And so you're really talking about incredibly small, minuscule, a fraction of a fraction of a fraction of a percent of an issue. And I think part of the considerations that one would have to think about if I were advising a patient would be, what's the risk of coronavirus? What's the risk of having a really bad outcome if you were to get coronavirus? And then what's the risk of Bell's palsy, with the vaccine? If I look at the risk of Bell's palsy, I'm talking about 1, 2, 3 out of millions, and we're not, or certainly hundreds of thousands, and we're not 100% sure that it's tied to the vaccine. If we're talking about coronavirus and potentially getting sick, those are real risks. And then not just oneself getting sick, but one potentially transmitting it to someone who could get sick, assuming that one doesn't get that sick. Those are real risks. And so that's how I would frame it and advise to someone.
Yes, I think one of the most important and sometimes devastating when you're doing research in graduate school phrases that my advisor used to say is that causation and correlation are not the same thing. So the 4 people in that clinical trial that potentially developed Bell's palsy, like you said, you have to look at the prevalence of it in a population and compare that statistically speaking. And although it happened while they were in the trial, that does not mean, and we have no evidence that supports that that would be as a result of the vaccine. So let's see, the next question. Do you know anything about how the vaccine will be dispensed to countries outside of the developed world? My home country, St. Vincent, has a rapidly growing number of cases, but I fear vaccine dissemination will not be prioritized because we are a third world country.
That's a great question. As some of you might look at my name and allude to the fact that I have family outside of the US. I'm Nigerian by background, and I still have relatives in Nigeria that I worry about. And so that's a phenomenal and really great question. One would need to kind of consider some things. One would be the cost of vaccines. Second would be what's called a cold chain, or basically transporting these vaccines. The mRNA vaccines require minus 70 degrees in the case of Pfizer, minus 20 degrees in the case of Moderna. And so, having the infrastructure to move that across those countries, as well as the cost of the vaccines. The AstraZeneca vaccine is shaping up to probably be the most cost effective while still having efficacy. And so, I don't know the exact plans. I know that World Health Organization and an organization called Gavi that works within the World Health Organization that works to disseminate vaccines are putting together resources with the plan of having countries basically, depending on the the economy of their country, they'll get some subsidy of the vaccine. And what I suspect is that it'll either be AstraZeneca, or if there's another vaccine called Janssen that's currently in phase 3 trials. If that proves to be effective, that's also going to be a little more cost-effective mechanism, or cost-effective vaccine. So I suspect it'll be one of those, and it'll kind of get more distributed to developing countries.
Okay, and so I think this question is actually going to take us a little bit back to the clinical trials and just kind of the process for that. But so it says, I've heard the vaccine isn't for children under 16. How do I protect my children that are 2 and 11 years old as they go back to daycare and school?
That's a great question. So with the clinical trials, they typically start with adults because it's easier to get informed consent from an adult, to explain to an adult what the trial is about and so forth. With the child, let me not say it's easier, but with the child, there's some other ethical questions, and usually it's a parent that needs to give consent for the child. So for the Pfizer vaccine, they did not include anyone initially that was younger than 16 in the clinical trials. For the Moderna and the AstraZeneca, the cutoff was 18. So they did not include anyone younger than the age of 18. Now that's initially. Typically what happens is once you establish that these vaccines are safe in your adults, then you now go back, not just safe in adults, but are effective in adults rather. Then you go back and you start recruiting children. And so I know that Pfizer and Moderna have already started recruiting children now. And so then we'll get more data on children and we'll be able to provide advice in terms of children.
And while we're on, that lane, what about pregnant women or women that are currently breastfeeding? What does the safety of the vaccine look like for them?
So vaccines are safe if you're breastfeeding. Pregnancy, I would say that there weren't enough people who were pregnant in the clinical trials to give a firm answer. But based on how these vaccines work in people, it's not anticipated that it should be a risk to the pregnant mom or to the fetus. And so the current CDC guidance is if you're in a category that where the vaccine is available to, which right now in the US is healthcare workers and people above the age of 70. So let's just say healthcare workers. If you're a healthcare worker and you're pregnant, you should still consider getting the vaccine.
Okay. What about, let's see, how does the COVID-19 vaccine affect folks who are HIV positive?
That's a great question. I'm an infectious disease doctor. That's my profession. And so I take care of patients who are living with HIV. In the Pfizer study, people living with HIV who are on medications were included in the trials. And based on what we know about how vaccines work and how these vaccines work, we anticipate that these should be safe for people living with HIV. And so I've been recommending it to all my patients who live with HIV. Right now, they would have to be over the age of 70 here in the US to be able to get it. And so I do have quite a few patients over the age of 70 who are living with HIV, and I've recommended that they all get the vaccine.
Okay. Do you know if there were any transgendered people that participated in the clinical trials, or if there's any data on how it affects a trans body?
That's a phenomenal question. I do not know if they were. I know that I was involved with, I was loosely involved with the trials. I was part of a group of Black physicians and scientists that were advising the 5 of the vaccine candidates on basically recruitment and retention of Black trial participants. I think there was a lot of emphasis on ethnic diversity, racial diversity, age diversity. unfortunately, I did not see too much emphasis in terms of transgender diversity. Now, based on what we know about how vaccines work, I would anticipate that the vaccine should still be effective in transgender individuals.
Okay, thank you. And we've actually had a couple of questions about this, so we're going to go back to moms, people that are pregnant. What if, is the vaccine recommended to a woman or a man that is trying to conceive in the next 12 months?
That's a good question. And so basically the short answer is yes. You can certainly still get the vaccine. That's the short and quick answer.
And I think it's also important for people who are pregnant or planning on pregnancy to still have this conversation in terms of risk with their healthcare provider, in terms of the risk of getting COVID, say in early pregnancy, which could be very detrimental to both mom and baby, and like kind of weigh that with getting the vaccine, especially if you have other risk factors, like say you're working in a long-term care facility, you're working in a factory where social distancing is difficult, that also will put you at higher risk. So in weighing that, it might be beneficial to get the vaccine versus putting yourself at risk of getting potentially a severe case of COVID.
Thank you, Renee. Yeah,
Great point.
That's a very good point. So there, we started the panel talking about the history of medical racism, and we've gotten a couple, of questions about that. And so one of them, it says that, how can the panelists looking at medical history definitively support the vaccine when it's so soon to tell without long-term concrete proof? And if the vaccine proves to be dangerous, how will they backtrack or retract their support statements? So
that's a great question. And so the first thing I would just say is that in terms of vaccine risk, in the history of vaccines, any issue that comes up with the vaccine will generally come up within 4 to 6 weeks of actually getting the vaccine. There has never been any complication from a vaccine that has happened outside of that early period. Okay, all the talk about autism and vaccines is completely wrong. The talk about cancer and vaccines is completely wrong as well. So in the history of vaccines, there's never been any complication, just to be very clear, that has happened outside of that early window of getting vaccinations. And so we have data in terms of safety up to 2 weeks post getting the second dose of the vaccine. And so, you know, from my standpoint, based on science, I don't anticipate there being any long-term problems. That being said, these individuals will be followed out to 2 years to confirm that. But based on science, based on how vaccines work, based on how the immune system works, I don't anticipate there being any long-term issues with that. In terms of the efficacy, in terms of the actual vaccines working, again, we only have short-term data which shows short-term protection. But these individuals, again, are going to be followed long-term, as well as the rest of us who are getting the vaccines are going to be followed long-term. Then the issue of, you know, whether I can look at it and honestly say, you know, I'm Black. I'm very much aware of our history with healthcare. I work in the healthcare industry, and I'm aware of challenges that people like myself face. I'm also aware that people like me were disproportionately affected by this pandemic. More people like me ended up in the hospital. More people like me and like us ended up dead, or a disproportionate number of us, let me say, ended up dead as compared to certain other groups. And so from my standpoint, what motivates me to be on panels like this and to try to address questions is the fact that, you know, we've been disproportionately hit by this pandemic. And there are a number of reasons for that. Some socioeconomic, some just a number of reasons. And so for me, it is really imperative that we're not shortchanged as the vaccine starts to roll out, that we're not falling behind, that it's important that we're not excluded. And that's why I'm able to stay here and speak on this.
Thank you. So I'm going to give you a test and I have the correct answer. So do either of you know what percentage of Black people participated in the clinical trials? Was one of the questions that we were asked. Don't worry if you don't, I looked it up very quickly.
I think in the Moderna study, it was like 9.3%.
Okay, Renee, you are correct.
And the Pfizer study, I don't know the percentage, but I know that there was maybe close to 3,000, like over 1,500 in placebo group and over 1,500 in the vaccine group.
Okay, Renee.
I looked at some charts yesterday, so.
So for anyone that would like an exact number, I'm not going to give an exact, but approximates. Approximately 2,000 Black or African American people participated in the Pfizer phase 3 clinical trials that actually received the vaccine. And then approximately 2,000 of them got the placebo. So totaling 4,000 African Americans that participated in the Pfizer vaccination phase 3 trial. And then there were approximately 1,500 African Americans that participated in the Moderna phase 3 trial and 1,500 in the placebo group, totaling out to 3,000. And in both of them, there were about 9.8 to 9.3 was the percentage of the participants that were African American. So look at you, Renee. Somebody studied. Okay. So this says, will I have a choice between the Moderna, AstraZeneca, and Pfizer vaccine?
I think that right now it's a little bit institution dependent. Here in the U.S., AstraZeneca hasn't been given emergency use authorization, and so it's just the Pfizer and Moderna, and it's a little bit dependent on the institution where one is at. At my institution, there's both, and I got the Pfizer because it came first. But I think when it becomes more widely available, there may be some choice in terms of that.
I have a question, not to jump the line. What if you got, this is probably so dumb, but like, can you get the Pfizer one first and then the Moderna one afterwards? Or does it have to be the same like brand, like for both shots?
Yeah, no, that's an excellent question.
An excellent one.
And so it has to be the same. It has to be the same. So if you got Pfizer first, you should get your second shot should be Pfizer. Moderna, if you got Moderna first, your second shot should be Moderna. The AstraZeneca is also 2 shots. There's another pharmaceutical company called Janssen that has vaccine in trials at the moment. If that's effective, it'll be really good because that's only just a one-time shot. And so that'll be good. It'll be good in developing countries. It'll be good here as well for those who don't want to get 2 shots. But we don't have that information just yet.
Okay, and that speaks to the question, also a question very similar to yours, Ashley, was just how many shots are there? So the ones that are currently approved in the United States, and I believe in the UK too, because.
Correct.
Okay, yeah, it's 2 shots and they are 21 days apart that you get those shots.
So so for the Moderna, it's 28 days apart.
Oh, okay, yeah.
So
okay,
that's the only small difference.
Okay.
Pfizer is 21 days apart, yeah.
Okay, perfect. Thank you. It has been observed that COVID causes long-term effects in some people. For those people that have had COVID, will the vaccine reduce or remove any of these effects?
That's a good question. I would say we don't know the answer yet. We don't have enough information. If I was to ask to give just my professional opinion based on what I know of vaccines and science, I would say probably not. But we would need to see the trials and see the actual data and see the numbers to know for sure.
Okay. Do you have any effectiveness related concerns about the number of Black people who have been involved in the clinical trials for some of the vaccines that we've mentioned?
No, I don't. But I want to make sure that I say that I do respect and understand why the questions are asked, but no, I don't have those concerns.
Yeah, and something I would just like to tack on to that, I looked this up quickly as well on the Census Bureau's website, just to make sure. In the United States, the population of African Americans is right at 13%. So they actually, the companies actually did try to get sample participants that were representative of the population and the sample size, you know, in various countries. So 10% sounds small, but when you're actually looking at the population in the US, and I'm not about any other country, I apologize, but in the United States, 10% actually tracks with what percentage of the US is Black or African American. So I just wanted to add that.
We probably wouldn't have that kind of data here in Canada because we don't like race-based data. So
oh,
we'll never know.
Never know.
Yeah. So there have been questions and some theories that have been proposed about blood type and the way that blood type affects your likelihood of contracting, your likelihood of having a more adverse reaction if you do contract. Is there any information or are there any issues with a person of a specific blood type taking the vaccine?
No.
Very succinct. Okay. Are there any resources that you are aware of that address the hesitancy of the Black community in taking the vaccine that maybe would be like a good infographic or something like that to be able to share?
Yeah, so the Coronavirus Prevention Network, or COVPN, has put together materials kind of trying to specifically target a specific demographics. They do have some material available targeting, and this material was vetted by members of the African American community, activists, and medical providers. And so I don't have the exact webpage off the top of my head, but one may Google Coronavirus Prevention Network, and then you'll be able to look at all the materials that they have available for people who are non-medical, and see some of the information that they put out there.
Don't worry, Dr. Nnedu, I got your back. It's in the chat for anyone that is interested. I just dropped the link to the Coronavirus Prevention Network's website in the chat, and they do have a very nice infographic. So to the person that asked that question, Ashley Thomas, that's in the chat box if you are interested. Is it safe for someone who is diabetic, under control in parentheses, to take the vaccine?
That's a great question. Now, if you're diabetic, you're at high risk of having a really difficult time with coronavirus. And so the vaccine is definitely safe in people who are diabetic. And I would very highly recommend it that anyone who's diabetic consider getting the vaccine.
And people with diabetes were also included in the studies, I think in both, but I'm looking at the Moderna studies, and people living with diabetes were included in both vaccine and placebo groups.
Okay, and this is a very important question. So I want to make sure that I ask this one. And it actually speaks to what you said earlier about vaccines and autism. For the record, anyone that has heard that, the paper that stated that information was retracted, which means that it was proven to be completely false and made up. But the question that is along that same vein is says, how would you address the rumors that the vaccines contain cells from aborted fetuses? Many people are refusing to take the vaccine for this reason.
Yeah, so the vaccine does not contain, none of the vaccine platforms contain cells from aborted fetuses, just to be very, very clear. And vaccines do not cause autism. I think the scientists that said that created probably the most harm and damage in my lifetime in terms of healthcare, because there's so many people, unfortunately, who have been misguided by that information. Autism is not related to vaccines at all. And just to be clear, there are no cells from a fetus in any way related to the vaccines.
Thank you. Okay, so this is a good question. And maybe Renee, as our nurse practitioner, this might be a good one for you. So as we deal with coronavirus, what can we do to make sure, what can people do, to make sure their unrelated healthcare needs are met, such as checkups, MRIs, cancer screenings, and are these services available in Ontario, Canada?
So this is a really good question. In the first wave of the pandemic in Ontario, there was a stop of elective surgeries, some elective cancer surgeries even, and routine cancer screening. So colon cancer screening, pap smears. However, in the summertime, those are back up and running. So all routine cancer screening is happening again. And it doesn't seem like now, unless something changes this week, that those will be taken off the table again. In terms of making sure other healthcare needs are met, other than COVID, I think that that's a huge issue that's actually happening. People are really scared to go to the ER if they have chest pain or if they have shortness of breath, and they could be having a heart attack at home. So if you have symptoms that could potentially be severe or life-threatening, you should absolutely be going to the hospital. If you are uncertain about if you need to go to the emergency department or not, you could call Telehealth Ontario, but many clinics are also offering phone appointments. So in terms of like my day-to-day work, it hasn't really changed. Like I still have a full schedule of clients that I'm talking to every day, just not all of them are seen in person unless it's for something that's urgent or something that needs to be done in person. So if you do have any healthcare issues that you're concerned about, definitely speak to a healthcare provider to see what can be done for you in a remote setting, or if you do need to actually go into the clinic or escalate your care in any way.
Thank you. Are there any differences in the U.S. that you want to mention, Dr. Nnedu?
No, I think kind of very similar to what Ms. Bradley said. We've tried to, so I live in New Orleans, and we were hit very early, shortly after our annual Mardi Gras celebrations. And during that time, similar thing, elective surgeries were canceled, and we had to change a lot of our visits to virtual visits. Right now, our numbers are going back up, following the Christmas and Christmas holidays and people traveling and so forth. But we haven't, we're still doing our procedures, and we have a lot more things in place to keep people safe when they come in. Everyone in the hospital wears a mask, and we have a lot of things in place to keep people safe.
To the point of the mask, are there real medical reasons why a person can't wear a mask?
No. No, so everyone should wear a mask. I've heard, I'm allergic, and well, you can use another material to wear a mask. So there, in general, the what I call medical or surgical masks are a little bit better than the cloth masks in terms of the protection it gives to you, the mask wearer. They'll both protect other people if you had COVID. But in terms of protection to you, the surgical masks work a little bit better than the cloth mask, but any mask is better than no mask. And find one that if you really truly have an allergy to cloth, then wear the surgical mask. If you have an allergy to the material in surgical mask, wear a cloth mask. But some covering, is going to give you some amount of benefit.
Okay. What about a person that has sickle cell anemia or any other form of anemia?
Yes, that's a really good question. Now, there weren't an overwhelming number of sickle cell people. I'm not sure if they reported on the number of sickle cell people in these trials, and so a lot of the recommendations will be extrapolated based on vaccines and how they work in people with sickle cell, based on the immune responses that we see from these vaccines. It shouldn't be an issue in someone with anemia, and it shouldn't be an issue in someone with sickle cell disease.
Thank you. Okay, this question says, do you know if the vaccine will be mandatory for international or domestic travel, work, employment, public services, and more?
So that depends on I think Canada and the US are probably a little bit different. In the US, it's hard to make anything mandatory. I'll just say certain, like public schools and, colleges and that sort of thing, sometimes do those things. But government itself, it's hard for government to make anything mandatory for anyone here in the US. In terms of travel, I have heard that some airlines are wanting people to have coronavirus vaccination cards. I've heard of at least one airline wanting to have that. I haven't heard too much about specific countries. I think as vaccines become more available, countries will kind of make their own rules in terms of whether or not they require vaccination or not.
Okay. And got a request to circle back to the pregnancy question. So is there a required wait time between receiving the vaccine and planning to get pregnant? So I know we said that there's no reason that a person that is currently pregnant or is breastfeeding should not get the vaccine, but is there a period of time that you should wait to try getting pregnant between getting the vaccine?
Yeah, that's a very good question. Again, so what we know is that it shouldn't be an issue in terms of affecting the pregnancy. If someone wanted to wait until whatever effects from the vaccine were over and clear, in general, one's immune response will sort of be kicked in and primed, by 2 to 3 weeks after getting the vaccine. So if one just said, okay, I just want to wait until my immune system has done its thing prior to getting pregnant, just out of an abundance of precaution, then, one could potentially wait that 2 to 3 week period and then begin trying.
Okay. Renee, you have another test question. Do you know if there were patients with sickle cell trait that were in any of the vaccine groups?
That wasn't specified in the vaccine groups, but like it wouldn't surprise me if, like, when we have more a breakdown of the trials, because there was actually like a good amount of Black participants, it wouldn't surprise me if some of them do have sickle cell trait, but that wasn't like specified. It wasn't one of the criteria that they were looking for in terms of illnesses that people might have in the population that they studied.
Okay, thank you. Can the vaccine cause things such as vasculitis?
Such as vasculitis.
Yes.
Not that's been seen in the clinical trials, no.
Okay. Will people with non-COVID illnesses, such as autoimmune diseases, cancer, be getting the vaccine before the rest of the general public? If you don't mind putting in the chat what country you live in, because I know that there's a link on the CDC website to what the different groupings are. So if you could put what country you live in, your answer will probably be much more helpful. But if you guys want to tackle that, just broadly.
For that one.
I'm sorry, what, Ashley?
The country was Canada for that one.
Canada, okay.
So I can't speak for Canada. Unfortunately, I'm not as familiar with Canada. Here in the U.S., we're doing phase 1, 2, and 3, and then phase 1 is broken up into 1A, 1B, 1C, and so we're so phase 1A was basically healthcare workers and elders living in long-term facilities because they've really been hit hard as well. And then phase 1B was basically phase 1A, and then everyone above the age of 70. Phase 1C will be those above the age of 60, as well as those who have comorbidities that put them at high risk for severe COVID. And so that's where immunocompromised people will fall into, would be phase 1C. Compromised people, diabetics, people with end-stage renal disease, folks with conditions that we know put them at high risk if they were to get COVID. And so that's the way the US has done it. That's in part because there's not enough supply, and there's been some distribution problems here on top of that. So, but that's the way it is here. And I think someone just shared the guidelines from Canada in the chat.
I did, yes. And I was going to try to look for the United States very quickly. Renee, do you have any more insight into Canada's rollout plan?
Yeah, so I believe right now we're still in phase 1, which is more healthcare workers, people who work in long-term care, and remote Indigenous communities. But in the second phase, which they've only really set as winter time, which who knows when that will really be, would be like increasing the amount of vaccines to healthcare workers, so like more broadly. And then that also looks like it includes people living with chronic conditions. And then the third phase would be more general population.
Okay, thank you. So Dr. Nnedu, a question for you. Can you speak more about vaccination recipients, the tracking process, and trust? Already there seemingly have been seriously / proven concern about the COVID tracking app. And before you answer that, Dr. Nnedu, I just want to say that the contact tracing application for COVID-19 is very different from people that agree to participate in a clinical trial and agree to follow up appointments. So although similar words are being used to say tracking, it's actually talking about two different processes. But if you want to speak more to that.
If I can understand the question, is this in reference to people in clinical trials and the app related to that? Is that what the question is asking?
I think that the question might be talking about both of those things as if they're one, but so maybe hopefully to get the intent of the question, what is tracking a person after they get the vaccination and understanding what happens to them subsequently? What does that look like?
Right. So I'll start with the clinical trials. In the clinical trials, the people who were enrolled, they had an app when they got the vaccine. They pretty much kept a log of things, including their temperature, vital signs, any symptoms that they may have. All those things were entered electronically and monitored very, very closely. That was in terms of the clinical trials themselves. In terms of actually giving the vaccine, so I believe Canada is in phase 1. We're in phase 1B here. In terms of actually giving the vaccine, there may be some differences between Canada and the US. Here, when you get the vaccine, you get a card. On the back of that, and that card is like a proof of vaccine. When you get your first one, the first dose place is checked. On the back of that card, there's a link or a web page where if you had any symptoms, you can go there and actually directly tell that you had those symptoms. In terms of an app, there isn't a specific app for people who are just getting the COVID vaccine, at least not that I'm aware of here in the US. But you do get a card, and on the card, the instructions on how to enter information if you were to have some type of problem with it. And then also people are encouraged to speak to their providers. And then in general, whenever people get the vaccine, they're kept in the clinic for at least 15 minutes for general people, and then 30 minutes for those who may have some history of allergies and there's any concern, and they're monitored, after the vaccine. And then they're given a card, and if anything comes up later, they can enter in those symptoms online.
Okay. As far as the effectiveness of the vaccine goes, if you are on an immunosuppressant or you are on a high dose of steroids, does it have potential to decrease the effectiveness of the vaccine?
That's a phenomenal question. There weren't enough immunocompromised people included in this trial to say with absolute certainty that the vaccine will be just as effective as it was in someone who's not immunocompromised. And so, historically, vaccines are typically not as effective, and depending on how immunocompromised a person is, not as effective. But we don't quite have as much information just yet about these vaccines in people who are immunocompromised in terms of the efficacy.
Okay. Can previous viral infections like CMV or EBV cause a systemic inflammatory response? And since coronavirus is a viral infection, COVID is causing blood clotting due to an inflammatory response, is it similar in nature to other viral infection? Is it the cause of long-term lupus-like effect of COVID? So I guess this is a two-part question. First, if you've had another viral infection like CMV or EBV, I'm assuming that's Ebola virus, can getting the COVID, can contracting coronavirus, can it cause your body to have a harsher systemic inflammatory response maybe? And then the second part of the question, I believe, is asking is that because some people are having blood clotting issues subsequent to getting coronavirus due to the inflammatory response, is it causing a lupus-like effect?
Yeah, so great question. So EBV is Epstein-Barr virus. I think someone put that in the channel. And then CMV is cytomegalovirus. And so both of those are types of herpes viruses that are very widely available. Majority of adults in the Western world would have been exposed to those viruses at some point in their lives, and sometimes don't even know that they've been exposed, and as such would have antibodies to them. And so having been exposed to those viruses previously and then getting COVID doesn't predispose you to having a worse outcome with COVID than, say, someone who hadn't been exposed to those viruses. And then the second part of the question is, so COVID certainly leads to a robust inflammatory response. That tends to be a big part of the disease itself. Part of that too is the formation of tiny amounts of clots in blood vessels in the lungs, and that also make it a little bit harder for oxygen to be exchanged. And that's another way in which people get really, really sick. I think the person was also asking if long-term problems or issues that we see with a subset of COVID patients, if that is in some way lupus-like in terms of the inflammation and vascular. And my answer would be that we're still learning about the long-term effects of COVID. I can't specifically say whether it's in any way lupus-like or not, because what we're seeing is people having slightly different manifestations of some of these long-term effects. And what I think will happen over the next several months is that there'll be a paper describing a lot of these effects, putting everything together, and then we can start to try to think through it and make some sense through it.
Okay. This question says, all of the different vaccines that are available, which one is the best one for you?
That's a very, very good question. I think we don't have, we're still getting more information. I think it's hard to pick. And so there are 3 that have published early findings from their phase 3 trials, and all have been promising. And as we mentioned, that's the Pfizer, Moderna, and AstraZeneca. And then there's the Janssen, which has, I believe, finished recruiting participants, and so is following them, and we'll probably get some preliminary early data from Janssen, I suspect, within the first quarter, or at least within the second quarter of this year. Then Novavax is a 5th vaccine platform, which just started its phase 3 clinical trials. And then Sanofi, I think there have been some holdups with their trials. And so those are the 6 vaccines that have been in trials kind of in North America, Europe, and around the world. But we haven't talked about the Russian vaccine. The Russian vaccine, in terms of the science behind it, is more similar to the AstraZeneca vaccine. And the Russian scientists are saying that it's also, it seems like it's effective. I think it was only, the trials for that one were only in Russia, but I can't 100% confirm that. The Chinese have a vaccine too, which I don't know too much information about. And so I think, hopefully moving on as the months pass on, we'll have multiple different vaccine candidates, and we'll kind of see. And I think and hopefully as these become more available, people will actually be able to have a choice. And I think the choice will be based on side effects that one is comfortable with versus not comfortable with. And that'll be my hope. My hope is that all of them will be effective and safe, and it'll just be a matter of what someone's comfort level is as far as potential side effects.
And You answered this earlier, but I see a question just popped up again, so I just want to restate it very quickly. That if you get part one of the vaccination from one company, then you should definitely be getting part two from the same
That's
company,
correct.
not doing like a you pick two or
That's
anything
correct.
like that. Okay.
That's correct. That's correct.
Perfect. Yeah. Alrighty. If a person has been quarantining throughout the virus, should they take the vaccine as well?
If they've been quarantined, you said?
Yes. So if they've been isolating, social distancing, following all of the guidance, staying away from people, is it recommended that they take the vaccine?
That's correct. So I would recommend that everyone consider getting the vaccine, including those who've been very diligent enough to follow public health guidance in terms of wearing masks and social distancing as well. I would suggest that everyone consider getting the vaccine.
Okay. And Renee, I think you had a very good answer. You kind of touched on this earlier. Someone asked, how do you balance the risks of the vaccine with the risks of COVID? Any guidance?
Yeah, so, it would just depend on like your one lifestyle. Like a lot of people are working in high risk settings. They need to leave their homes to go to work. Maybe they have family members who are immunocompromised. So that is one consideration. I think the most important thing is, one, like with the vaccine data that we have, the data is very good. They used like very large population in terms of who was tested for the vaccine. And then we have really high efficacy rates of 94, 95%. Whereas if you're putting yourself at risk for getting actual COVID, we are seeing some people who have mild cases, but then we are seeing people who are getting very critically ill. So I think it just depends on like where your comfort lies, what's happening in terms of what you do in your day-to-day life, who's in your social circle, what things you want to continue to do or you're hoping to do in the future. But I think that nobody really wants to get a critical illness. And like for me personally, like I know that I really don't ever want to be in an intensive care unit. So like that's for me a huge motivation for me to get the COVID vaccine.
And along those same lines, what is the most effective way to protect from contracting coronavirus as we wait for the vaccines, especially when you're out in the community and doing things like going to get groceries?
So I think continuing to wear masks as much as possible. Proper hand washing is good. Using hand sanitizer where it's available. Distancing yourself from large groups of people, really like adhering to the public health guidelines that are out right now, since we have cases, at least in Ontario, that are very high. We're really discouraging mixing of households. So I think following those guidelines are really important as we wait for the vaccine. And I think now is a time to really be even more diligent, because now we do have a vaccine available. So hopefully there is an end in sight. So we're almost getting closer to hopefully getting back to a normal lifestyle. So getting COVID now, I think, would be particularly disappointing.
I know we stated previously that long-term immunity, or how long immunity from the vaccine lasts, isn't fully known, but is there any information around if we'll need to get boosters or how often we would need to get a booster after the first 2 dosages of the vaccine?
No, that's not been determined just yet. More information will come out and we'll get more data as far as how long the immunity lasts. Until that happens, we won't know if a booster is needed or not.
Okay, and speaking about the 2 shots, is it true that you don't have to get the shots on the exact days. So the 21 for Pfizer, the 28 for Moderna, that it's just a ballpark and it can be extended up to 42 days?
So I would encourage those who are thinking, and that's a great question. I would encourage everyone who are thinking of getting the vaccine to try to get it on schedule. In general, if you're later, it's still okay based on how the immune system works. But I would still encourage everyone to try to get as close to the scheduled time as possible.
And then, so this is a question related to transmission. Do you think the virus is airborne or contagious? And I would just like to add on to this, is there information on the most common ways that it can be transmitted, between people?
Yeah, so the most efficient way in which it's transmitted is through the air, through breathing, and basically through droplets. And so there was a lot of debate about droplet versus airborne, and I want to sort of clarify those things. Droplets generally don't go, say if I cough and it's something that's transmitted by droplet, droplets are bigger and they don't go more than 6 feet. In fact, most of the times it doesn't go more than 3 feet. So generally it won't go more than 3 to 6 feet at the longest. And that's where this 6 feet of social distancing comes from, because we believe, based on existing information, that coronavirus is primarily via droplet spread. So droplets through the air, because of their size, they don't go further than 6 feet. And so social distancing by 6 feet is sort of what's recommended. Airborne is slightly different. These are very tiny microscopic that can basically stay in the air and float in the air and can stay there for hours. And so in that situation, 6 feet or no 6 feet doesn't necessarily make a difference. So things that are airborne would be things like measles. Measles is the most classic one. Tuberculosis as well would be another one. And so that's important, because for airborne, you would need an N95 mask. And the recommendations are not for everyone in the community to run around with N95 masks, because then that'll cripple the healthcare. And so for the most part, coronavirus is a droplet spread, meaning that 6 feet distancing is good, and the regular surgical masks are good enough in terms of keeping you safe, and one doesn't need an N95 mask. Now, that being said, coronavirus can be, and this is where it gets a little confusing, it can be made airborne by certain procedures that we might do on a patient, such as basically procedures that pump air into the lungs and make it come out. And so as a protection for healthcare workers, when we're going into rooms of patients who we know have coronavirus, we wear the N95 mask, and we generally, just in the population for EMS or anyone who's going to someone who actively has coronavirus, you wear the N95 mask just as a precaution.
If someone has lupus anticoagulant clotting disorder, would they be at high risk for COVID complications?
Yeah, that's a great question. So specifically lupus and COVID, that particular link has not been shown in terms of our studies that we've seen. The things that we know for sure put people at high risk are age above 70, diabetes, end-stage renal disease, chronic lung disease, chronic heart disease as well. And we believe that immunocompromised patients are also at higher risk, and we're getting more information that seems to suggest that. And so those are the things that have been shown to put people at high risk for severe COVID and potentially death with COVID.
Okay, and we are getting close to the end of our time, and I want to make sure that we are being a good steward of everyone that has come to listen, as well as the panelists' time. So I think that this is an excellent question to end on, and it's how can we best fight misinformation?
I'll let Ms. Bradley tackle that first.
I think the best way to fight misinformation is just to make sure you're getting information from good and scientific sources. It's not great to be getting information from TikTok or Instagram. I think there's also a lot of people who have a lot of conspiracy theories. So it's good just to go to the source. So like a lot of the studies, all the studies are available. At least the Pfizer and the Moderna studies are available. They're fairly easy to read. So that is a good way. Going to the CDC website or World Health Organization are also good and legitimate sites to be getting information. So I think just reducing the amount of, from people who really like aren't physicians, who don't have education in science related backgrounds, I think it's better to kind of just minimize the amount of information you're getting from those sources.
That's an excellent answer, and I agree. I think the CDC and WHO have this information distilled in a presentable way that's understandable, and I think that's a great source. I think finding a healthcare provider that you trust, that can sit down with you, go through the pros and cons, or can refer you to someone who can go through the pros and cons and go through all the information with you is really key. And then I think for us as Black people, to me, I always try to respect the fact that due to our history, there is some level of mistrust that's there. And in my practice, I just try really hard to respect that, understand that, and try to explain the reasons why I think this vaccine is so important. And I think a big reason is that we really have been hit really hard. I've personally lost a lot of patients to COVID. Our community has been hit really hard. And so I worry that we're gonna fall behind as vaccines start to roll out. And I don't want to see that. I don't want us to keep getting hit and hit hard by this. And so I jump at any opportunity I can to speak at forums like this because I think it's really important. I hope more forums like this, and I want to commend those that organize this. I hope that there are more forums like this along the line. I've done a few of these now, and I'm always eager to do them because I really think it's important that we hear the information, from someone that looks like us, or from people that look like us, and that we process it and really consider getting the vaccine while we continue wearing our mask and social distancing in the meantime.
Yes. Thank you, Dr. Nnedu and Renee, so much for volunteering your time to have this conversation and answer these questions. Thank you so much, Ashley, for seeing a need and being willing to fill the gap. And I know you reached out to me on Twitter and just really seeing, like I said, the need for this in making it happen. I don't know if there's anything that you would like to say, Ashley, before we end the session tonight.
I just wanted to say thank you for doing a good job moderating. Round of applause for all three of you. Thank you so much for all of your contributions tonight. The need was there, and I think we've taken good steps in the right direction. Real quick, I just wanted to shout out the Rising Youth Community Service Grants, Taking It Global, and Canada Service Corps for providing me a small grant to help pay my panelists who were here today. And I wanted to shout out everyone who stuck with us for the 2 hours. that we had put this panel on. I have made a recording, and once I get everyone's permission, I will release said recording. Unfortunately, I forgot to record the first half, but we still got the question and answer period in there, so that was good. Yes, thank you all once again for coming, and you all got my email address if you need to reach out for any reason, and have a good night and stay safe. Take care.
Thank you.
Thank you.
Everyone.